Assalamu alaikum. Beta, in this video lecture I will deliver the lecture on endometrial polyps. Okay, in the previous video lecture I delivered endometrial hyperplasia, and now I will continue with the benign lesions of endometrium and then malignant lesions of the endometrium. Okay, by the way, endometrial polyps, they are benign exophytic masses coming out of the endometrium. They vary in size. They are variable in size. They may be as smaller as zero point 0.5 centimeter, or they may be as larger as 3 centimeter. Can you see these are the nice little fallopian tubes? Okay, one on this side, and this is the nice, kind of uterus on both the side. This is endometrium, and this below, opens into the cervix and then vagina. Can you see this kind of exophytic mass coming out of the endometrium? This is the endometrial polyp. This is the endometrial polyp which is coming out, okay, from the endometrium through this nice little stalk. There may be stalk or may not be stalk. It's not necessary to have a stalk, every time, but there may be this stalk. Okay, so endometrial polyp is this benign exophytic mass. Okay, they project into the endometrial cavity. You can see it is coming out of the endometrium and it is now present in the endometrial cavity, this cavity. Okay, they may be single in number or they may be multiple in number, right? They are occasionally large and pedunculated. Most of the times they are small outgrowths, but occasionally they may be large, and occasionally they are pedunculated. Pedunculated means they have stalk. If they have stalk, they are called pedunculated. But if they do not have stalk, okay, if this type of growth occurs, this endometrial polyp is non-pedunculated because it is not having any stalk. It is directly attached to the endometrium. Okay, if it is having a stalk, it is called pedunculated. Occasionally they are pedunculated. Occasionally they have a stalk. Most of the times they are like this, not pedunculated. Okay, these polyps of the uterus may be, asymptomatic or may cause abnormal bleeding. Bleeding may occur due to these polyps. These polyps, बेटा, अगर इनमें नेक्रोसिस हो जाए या फिर ये जो पॉलिप्स हैं ये एंडोमेट्रियम की वॉल को नीचे अल्सरेट करें और ब्लड वेजल्स को रप्चर करें, तो मुमकिन है कि इस रूट से bleeding होगी. ठीक है, and that bleeding will be surely abnormal bleeding, and that bleeding may be postmenopausal. If let's suppose you are 60 years old woman and you develop this polyp in your endometrium, then there will be bleeding. Okay, that will be called as postmenopausal bleeding. Okay, and the woman must be worried about this now, because she is now 50-60 plus. She is now postmenopausal, so she must be worried about that why there is bleeding if she is menopaused. So that bleeding may be due to this endometrial polyp. Okay, that abnormal bleeding may be menometorrhagia. It has two terms, menorrhagia and metorrhagia. Okay, menorrhagia is हैवी मेंस्ट्रुअल ब्लीडिंग ड्यूरिंग रेगुलर पीरियड्स. जो रेगुलर पीरियड्स आते हैं बेटा, उनके दौरान जो ब्लीडिंग होती है उसका बहुत ज़्यादा हो जाना. और मेटोरेजिया होती है ब्लीडिंग एट इरेगुलर इंटरवल्स. मतलब नॉर्मल पीरियड्स के जो दिन है बेटा 5 से 7, उनके अलावा भी ब्लीडिंग का होना irregular intervals पे, that is metorrhagia. And there may be intramenstrual bleed, that is light bleeding or spotting between periods. मेनोमेटोरेजिया और इंट्रामेंस्ट्रुअल ब्लीडिंग का एक फ़र्क ये होता है कि मेनोमेटोरेजिया में हैवी ब्लीडिंग होती है. इंट्रामेंस्ट्रुअल ब्लीडिंग रेफर्स टू लाइट ब्लीडिंग और स्पॉटिंग. ओके, और ये पीरियड्स के बीच में जो इंटरवल्स होते हैं उसमें होती है. और इसके अंदर जो दो टर्म्स है बेटा, मेनोरेजिया और मेटोरेजिया, they include heavy bleeding. Okay, right. Now what are the components of the endometrial polyp? What are the components of the endometrial polyp? You tell me from where the endometrial polyp is arising. It is arising from this endometrium. So the components of endometrium will be the components of polyp, because polyp is actually arising from the endometrium. So endometrium will surely be containing all those components which are present in the endometrium. So I told you in the previous lecture, the endometrium is composed of stroma and glands. So these two components must be present in the polyp. And one thing that I need to mention here is, beta, the stromal cells of the endometrial polyp, they show some chromosomal rearrangements, and that's why we say that the stromal cells of the polyp are neoplastic. Okay, if I draw a polyp here, if this is a polyp, let's suppose these are some glandular cells, and remaining part is all stroma. And in these stromal cells, if I take one stromal cell out, these are glandular cells, by the way, okay? I'm talking about stromal cells. If I take one stromal cell out, then there will be chromosomal rearrangement, and this is suggestive of neoplastic change. And we will say that in endometrial polyp, there are two components, stroma and glands. The stromal cells show chromosomal rearrangement. ठीक है, इसकी वजह से हम इन सेल्स को नियोप्लास्टिक कहते हैं, ठीक है, क्योंकि म्यूटेशंस हैं इनमें. अच्छा, जो ग्लैंड्स मौजूद हैं पॉलिप के अंदर, दे में भी एट्रोफिक और में भी हाइपरप्लास्टिक, ठीक है, ज़्यादा भी हो सकते हैं, एट्रोफिक भी हो सकते हैं, नॉट रियली श्योर. एंड द ग्लैंड्स, दे आर ओकेशनली दे आर सीक्रेटरी. दैट मीन्स द ग्लैंड्स विच आर प्रेजेंट इन द पॉलिप, दे मे बी सीक्रेटरी ओकेशनली. दैट मीन्स they secrete out some secretions. So if the glands are secretory, and then that type of polyp is called functional polyp. Okay, endometrial polyp is called functional polyp when the glands are functional, they are producing some secretions. Okay, now I will tell you the role of tamoxifen drug. Tamoxifen is the drug which is mostly used in the treatment of the breast cancer, because tamoxifen has better anti-estrogenic effect on the breast. Because tamoxifen has anti-estrogenic effect on the breast, so it is very much effective drug for the treatment of breast cancer. But by the time you should keep in your mind that tamoxifen is also having weak pro-estrogenic effect on the endometrium. तो tamoxifen का जहाँ breast पे anti-estrogenic effect है, वहीं पर एंडोमेट्रियम के ऊपर प्रो ईस्ट्रोजेनिक इफेक्ट है, यानी कि एंडोमेट्रियम के ऊपर प्रो ईस्ट्रोजेनिक इफेक्ट है. और आपको पता है बेटा, जब ईस्ट्रोजेनिक इफेक्ट प्रोड्यूस होता है एंडोमेट्रियम पे, तो क्या होता है, एंडोमेट्रियम मल्टीप्लाई करती है, उसकी ओवर ग्रोथ होती है, और हाइपरप्लेजिया भी हो सकती है एंडोमेट्रियम में, पॉलिप भी बन सकते हैं, ठीक है. एंड वंस यू डेवलप एंडोमेट्रियल पॉलिप, there are chances to develop adenocarcinoma, but rarely. ठीक है, endometrial polyp may develop into malignant and adenocarcinoma of the endometrium, but rarely. Okay, so that's all about beta this lecture on endometrial polyps. Hope you got some concepts. Thank you so much. Class dismissed.